everyone, I'm Omodara Mills. Welcome to Inside Health. In this video series, we explore various departments, units, and services of the Tobago Regional Health Authority, the TRHA. We'll take you behind the scenes to show you how they contribute to the quality healthcare services provided to you, our people. Today, we're going inside the Lab Services Pathology Department. Want to know what that unit is all about? Well, stick around and find out what's done behind this door of the Tobago General Hospital. We're here with Ms. Charmaine Burrell, manager of the lab services at the Tobago General Hospital. Ms. Burrell, just for those who may not know or give us a better understanding of what the lab is responsible for at the hospital.
The laboratory is responsible for diagnostics of patients throughout the island. We serve all health centers as well as the main facility here at Tobago General Hospital. We do diagnostics, all levels of diagnostics, hematology, biochemistry, blood grouping, as well as histology and microbiology. All these areas are being done right here. The samples are collected from the health center and it's brought here for testing. We have 3 phases of testing and it starts in the health center. The first phase is collection of primary sample from the patient. They're prepared for the collection of samples. The samples are collected and it is transported to the laboratory. The temperatures are maintained under strict temperature control during this transport system, and it's taken into reception, sorted, and brought into this laboratory area, shared between all the various disciplines I just mentioned, and tested. We are also very serious with quality control and reporting on time.
Diagnostics are blood tests conducted to determine medical conditions such as diabetes, sickle cell anemia, high cholesterol, and HIV/AIDS. Tests can assess how well organs like your kidneys, liver, heart, or thyroid are functioning. They can show how well you are managing your illness. Check whether the medication you're taking is having the desired effect, and indicate if you're at risk for conditions like heart disease. They can even tell if your immune system is having problems fighting infections, and assess how well your blood is clotting. Blood grouping tests determine your blood type, such as A positive, O, or B negative. You all are getting a blood bank analyzer for the lab. Could you tell us what are your thoughts on the lab getting this kind of machine?
The blood bank analyzer will assist us in improving our accuracy, our precision, our specificity, and we will be able to have samples and reports ready in a short time. This piece of equipment, which we will be getting at the laboratory, will have the same principles of testing as we do currently. The manual testing that we do currently is the same principle of test. It will be done just quickly and more accurately. This piece of equipment will assist us in phenotyping, in compatibility testing, as well as in antibody identification.
If you look around here, this is the area that the technicians usually do their blood work, the blood typing, the cross matching, that type of stuff. Now, that stuff right now is done manually, and it's done using the range of equipment here. The analyzer we now acquire would allow us to do all this work automated. So that improvement, I think that personally in itself is an improvement to have automation of that process, in that if you have a situation like where you have a heavy load testing to do, or let me say have less technicians do that testing with the amount of load, instead of doing all of that work manually, it could be done automated. So, that automation is an improvement in and of itself for the region, yeah.
Compatibility tests are done to ensure that the donor's blood or blood components given via transfusion are correctly matched with the recipient's blood type. The cross-matching test eliminates the chance of any serious adverse reactions for the recipient. So it's quite a lot, a range of services that you all provide for the hospital as well as the health centers. I wanted to find out about the blood bank unit, which is a vital part in terms of persons giving blood so that patients would be able to get blood when it is needed. Could you just give us an idea of that part of the process?
It's under the nurses section, but they are housed in the laboratory, at least for convenience at the moment. And when the units of blood come in, we test immediately for what groups they are. We do a series of screening tests with regards to antibodies and phenotyping. And later on, we do compatibility testing for these units so that we can find the correct blood unit for each individual.
Okay, and tell us, why would you encourage persons who can give blood, and why would you encourage persons to give blood?
Blood saves lives. We cannot move forward if we do not donate blood. It is our personal gift to another person who is in crisis for blood.
Tell us when you would have started to donate blood and why.
Would have been about 2001. We had someone who was unwell, and they asked us for assistance. And that's how I gave blood for many years. And maybe about 2013 or 2014, I started becoming a regular, because blood is important. You need it. People need to live, basically. Blood is life. So you need to come give blood, give assistance. It's good. It's good in a sense that when you need it, sometimes you don't get it. They don't have enough blood donors. We need more blood donors. And I think that's something that the whole country should be partaking in. It's really important. One day you could be on the chair and you need it. So you always have to consider that what you want for yourself, give to others.
Well, it's good for them. It's good for the individual to donate blood. It helps you to live a healthy lifestyle, all right? And you save lives, right? Because one unit of blood could save about 4 lives, because they separate the blood and get different products from the blood, all right? So this is why we encourage people. From the age of 18 to 60, these are the ages that you can donate blood. A 17-year-old could come, but the parent or the guardian must accompany that child, all right? And also, over the age of 60, if you are a regular voluntary donor, you can donate, all right? But other than that, it's 18 to 60 years.
us an idea of some of your plans that you will have to see improvement in the lab?
Well, our lab improvement is improvement overall in the health of Tobago's people and the population here. What we hope to achieve as well is components harvesting, I should say, is something that we would like to include into the laboratory. We would like to harvest those blood units that we donate here and divide them into separate portions so that we can have FFP, we can have packed blood cells, as well as fresh frozen plasma and cryoprecipitate. We have procured the equipment for that. I believe that management is working assiduously to have all these things in place.
Any final words, Ms. Burrell, on the importance that the laboratory has in providing the services that would help to improve or to ensure that the patients on the ward, the doctors, ensure that there's quality healthcare services provided to Tobagonians or whoever else would come to the hospital?
Well, the laboratory diagnostics, we represent diagnostic services. We are absolutely key to the services that function here. The doctors, nurses, they would be blind without the pathology laboratory. 70% of patient notes are actually blood results. And if we do not have blood results, accurate, reliable blood results in a timely manner, patients will be challenged to getting well.